Perpetrator in question is usually a fungus called Candida. Candida is not an unwelcome guest. In fact, small amounts of this fungus normally live in our mouths, on our skin, and yes, even in our vaginas without causing any problems. The trouble starts when Candida starts to multiply uncontrollably. Now, you might be wondering, what leads to this sudden population explosion of Candida? Well, a variety of factors can tip the scales in Candida's favor. These include a weakened immune system, high estrogen levels, or certain health conditions like diabetes. Even something as simple as taking antibiotics can disrupt the balance of microorganisms, giving Candida an opportunity to take over. A vaginal yeast infection, also known medically as vulvovaginal candidiasis, is quite common. It's estimated that nearly 3 out of every 4 women will experience at least one vaginal yeast infection in their lifetime. But rest assured, while they can be uncomfortable, these infections are usually not serious. So there you have it. A vaginal yeast infection is essentially a disruption of the delicate balance of microorganisms in the vagina, typically caused by an overgrowth of the Candida fungus. Now that we know what a vaginal yeast infection is, let's explore its causes. But before we do that, let me introduce Linda Allen. Linda Allen, a certified nutrition specialist, health consultant, and author, penned this comprehensive guide after a 12-year battle with chronic yeast infections. She provides a 5-step, holistic approach to treating yeast infections, aiming to eliminate the root cause of the problem, not just mask the symptoms. Allen's first key point is the importance of a balanced and nutritious diet. She believes that a diet rich in lean proteins, whole grains, fruits, and vegetables can help maintain a healthy balance of bacteria in the body, reducing the likelihood of yeast overgrowth. Secondly, she emphasizes the significance of a healthy lifestyle. Regular exercise, adequate sleep, and reduced stress levels can bolster the body's natural defenses, making it less susceptible to yeast infections. Thirdly, she advocates for the use of natural remedies. This includes probiotics, garlic, coconut oil, and tea tree oil. These natural remedies can help restore the body's natural balance and fight off yeast overgrowth without the side effects of conventional medication. Fourthly, Allen underscores the necessity of personal hygiene. Keeping the vaginal area clean and dry can prevent the environment favorable for yeast growth. Finally, she encourages readers to listen to their bodies. Understanding your body's signals can help identify potential triggers and take preventative measures in a timely manner. You can download her best-selling ebook at www.alexon.com in the description. You will also receive a free email mini-course. Scene script. We will now continue the presentation. Uncover the triggers that lead to a vaginal yeast infection. So, what exactly causes a vaginal yeast infection? Well, there's no one-size-fits-all answer as it can be triggered by a variety of factors. Let's dive into some of the most common ones. First, antibiotics. While these medications are crucial for fighting off bacterial infections, they can also kill the beneficial bacteria in the vagina that keep yeast levels in check. When these good bacteria are wiped out, yeast can multiply, leading to an infection. Second, hormonal imbalances. Changes in hormone levels, particularly elevated estrogen, can feed yeast growth. This is why some women may experience recurrent yeast infections during certain phases of their menstrual cycle or while pregnant. Third, a weakened immune system. If your immune system isn't functioning at its best, it may not be able to keep yeast at bay. Conditions that can weaken your immune system include HIV, diabetes, and autoimmune disorders. Fourth, high blood sugar. Yeast feeds on glucose, so when blood sugar levels are high, it can create a conducive environment for yeast to thrive. This is why women with uncontrolled diabetes may be at a higher risk. Fifth, tight and non-breathable clothing. Yeast thrives in warm, moist environments. So, wearing tight-fitting pants or underwear made from synthetic fibers can create the perfect conditions for a yeast infection. Lastly, sexual activity. While vaginal yeast infections are not considered a sexually transmitted infection, they can be passed between partners during sexual activity. But remember, everyone's body is unique. What triggers a yeast infection in one woman may not cause the same issue in another. It's all about understanding your body and identifying potential triggers. Understanding the causes is key to prevention. But how do you know if you have a vaginal yeast infection? Discover how your body signals the presence of a vaginal yeast infection. This is a crucial step in identifying and addressing the issue promptly. The symptoms can be uncomfortable and disruptive, but they are your body's way of alerting you that something is off balance. First and foremost, one of the most common symptoms is itching. It's not your run-of-the-mill itch, but rather a persistent, bothersome itch that resides in and around the vagina. It can be quite intense and is often accompanied by a burning sensation, making it difficult to ignore. This burning sensation can also be felt during urination, similar to the discomfort experienced with a urinary tract infection. However, a vaginal yeast infection is different and requires its own specific treatment. Another related symptom is pain during sexual intercourse. This discomfort can range from mild to severe, and it's important to listen to your body and not ignore this sign. Now let's talk about visual signs. Redness and swelling of the vulva are often noticeable. This inflammation is a direct response to the overgrowth of yeast in the vagina. Another telltale sign is vaginal discharge. This discharge associated with a yeast infection is typically described as looking like cottage cheese. It's usually white, clumpy, and odorless. However, every woman is different, and the discharge can sometimes be thin and watery. Lastly, some women may experience a rash or soreness in the vaginal area. These symptoms, combined with the others, can significantly impact your daily life and comfort level. It's important to remember that while these symptoms are common, not everyone will experience all of them. Some women may have a yeast infection without noticeable symptoms, making regular checkups essential. Recognizing these symptoms can prompt you to seek medical help. But what does this help involve? Stay tuned as we delve into the treatment options for vaginal yeast infections in our next segment. Explore the various options available to combat a vaginal yeast infection. When it comes to treating a yeast infection, there are numerous avenues you can explore. These range from readily available over-the-counter medications to prescription drugs and even some home remedies. The important thing here is to consult with a healthcare provider to make sure you're choosing the right treatment for your symptoms. Over-the-counter antifungal creams, ointments, and suppositories are often the first line of defense. These include medications such as meconazole, tioconazole, clotrimazole, and butaconazole, to name a few. They come in 1-day, 3-day, or 7-day courses, and are generally effective for mild to moderate infections. If over-the-counter treatments aren't enough, or if you're experiencing recurrent infections, your healthcare provider might prescribe a stronger antifungal medication. These can include oral antifungal drugs like fluconazole, or a more potent topical medication. It's essential to take these exactly as prescribed and finish the course, even if your symptoms improve before the treatment is over. In addition to these medical treatments, there are also a number of home remedies that some people find effective in managing their symptoms. These include probiotic supplements, which can help balance the natural bacteria in your body and prevent yeast overgrowth. Some people also find relief with natural remedies like tea tree oil or apple cider vinegar, but it's important to use these cautiously and under the guidance of a healthcare provider, as they can sometimes cause irritation. Dietary changes can also play a part in treating and preventing yeast infections. Eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help keep your immune system strong and prevent yeast overgrowth. Cutting down on sugars and refined carbohydrates can also help, as yeast thrives on sugar. Remember, while these treatments can be effective, they're not all suitable for everyone. It's crucial to consult with a healthcare provider before starting any new treatment, especially if you're pregnant, have a weakened immune system, or have recurrent yeast infections. They can help guide you towards the most effective and safe treatment for your unique situation. It's also worth noting that while these treatments can help manage the infection, they don't address the underlying cause. This means that even after successful treatment, you could still experience recurrent infections if you don't make the necessary lifestyle changes to prevent yeast overgrowth. Treatment can help manage the infection, but wouldn't it be better if we could prevent it? Prevention is always better than cure. In the next scene, we'll be looking at some of the strategies you can use to avoid getting a yeast infection in the first place. Scene script: learn how to keep vaginal yeast infections at bay. As we navigate through the journey of life, prevention is our best friend. Just like we shield ourselves from the sun or the rain, we can safeguard our bodies from vaginal yeast infections. So how do we do this? Well, it starts with simple habits that anyone can incorporate into their daily routines. First, maintaining good hygiene is paramount. Regular bathing, especially after exercise, can help keep the area clean and less conducive for the yeast to thrive. But remember, the vagina is self-cleaning, so avoid douching or using harsh soaps, as these can disturb the natural balance of bacteria and yeast. Next, let's talk about your wardrobe. Wearing breathable underwear, preferably cotton, can help keep the area dry and prevent the growth of yeast. Tight-fitting pants or synthetic fabrics can trap moisture and create a suitable environment for yeast to flourish. So, opting for loose, comfortable clothing can make a world of difference. Diet also plays a role in preventing yeast infections. Consuming a balanced diet rich in fruits, vegetables, and whole grains can boost your immune system and help your body keep yeast under control. Additionally, probiotics found in yogurt and other fermented foods can promote healthy bacteria in your body, including your vagina. Now, let's touch on antibiotics. These medications can be lifesavers, but using them unnecessarily can disrupt the natural balance of your body and lead to a yeast infection. Always consult with a healthcare provider before starting any new medication. Lastly, managing stress is key. High stress levels can weaken your immune system, making you more susceptible to infections. So, finding ways to relax, be it through yoga, reading, or a walk in the park, can help keep your body and mind balanced. Prevention is always better than cure, but there's more to this story. Delve into Linda Allen's holistic approach to fighting yeast infections. We've navigated the murky waters of vaginal yeast infections, understanding their causes, symptoms, and treatment options. We have already explored a natural, holistic approach to treating yeast infections by Linda Allen in her ebook, Yeast Infection No More. This brings us to the end of our insightful journey into the world of vaginal yeast infections. Before we say goodbye, here's a quick recap of what we've learned today. We've peeled back the layers on vaginal yeast infections, revealing that they're caused by an overgrowth of a fungus called Candida. This overgrowth can be triggered by many factors, such as antibiotics, hormonal imbalances, or a weakened immune system. We delved into Linda Allen's Yeast Infection No More, an insightful resource for those seeking a comprehensive approach to battling yeast infections. We've also highlighted the symptoms to watch out for, things like itching, burning, and unusual discharge. These aren't pleasant, but they are your body's way of raising an alarm. Then we moved on to discuss treatment options, which range from antifungal medications to lifestyle modifications. And we can't forget prevention, the cornerstone of health. Simple actions like wearing breathable underwear and maintaining good hygiene can make a big difference. Remember, knowledge is power when it comes to your health. Stay informed, stay healthy. Do not forget to subscribe, like, share, and comment if you find this video informative.